Members of the Canadian Health Coalition welcome the introduction of the Pharmacare Act, Bill C-64. This landmark legislation is an important first step, but there are many more steps to achieve universal coverage on the National Formulary of Medicines. We urge the government to ensure the legislation adheres to a single-payer national universal public delivery in partnership with provinces and territories, along with adequate funding and accountability measures in accordance with the principles of the Canada Health Act.
I've been a type 1 diabetic for 19 years. I'm also a gig worker in my 30s. And as such, like many, I don't have private health insurance, and I either cannot qualify or cannot afford to pay for a plan myself. My out-of-pocket costs stand at about $450 a month.
I was struck by some of the choices you have to make on a regular basis, given your health and the cost of medication. Can you elaborate a little bit more on some of the challenges that you face currently?
At one point, when I had finished a work contract, I did have private insurance. And when it came time to finish that work contract, I was told by that private insurance provider that because of my pre-existing condition that I was not able to go on to the bridging insurance that would normally be offered.
And of course, wanted to shout out to the Canadian Health Coalition and thank Mr. Staples for being here. Mr. Staples, we've heard from one party in the House of Commons, the Conservatives, and from a number of lobbyists that the system's working really, really well. What we have in Pharmacare now just works well in Canada. You deal with frontline workers, nurses. Is it true that everything is just fine when it comes to access to medication?
Mr. Julian, I share your concern. When I hear witnesses say the system's working very well, I ask for who is it working very well? We just heard from Mike Bleskie. It doesn't sound like the system's working very well for him. So it seems to be working for industry and insurance companies, but it's not working well for all Canadians. So that's why this Pharmacare Act is so important. Again, also hearing that the Canadian Health Act, in the view of industry, creates uncertainty. I would differ. I think the Canada Health Act is very important. For 40 years, it's made a guarantee that Canadians, when they need medical care, they will get it not based on who they work for or what insurance program or how much money they have. They'll get the care because they need it. Listen to what people are saying. Is that the system that we want to have for the rest of the country, or do we want to go with the kind of single-payer national universal system that's envisioned in Bill C-64?